All right. I want to reach out to everybody today. We are heading into NFL Week 6 with our Start or Sit podcast. This is Dr. Christopher Hawkins from Washington Orthopaedic Center. I'm coming to you solo today, filling in for Shannon, and we're going to be talking a little bit about some of the injuries and about what we expect with regards to players and their participation this week and in the coming weeks. The first person that I think we should talk about today is Rashad Penny. As everybody knows in our area, he is a big part of the Seahawks offense, especially with the new look of the team this year. And he had really been sort of coming into his own and basically getting a lot of strong yardage on the ground, and really kind of becoming possibly a number one running back in the league. Unfortunately, he suffered a rather significant ankle injury this past weekend, actually had to be helped off the field, difficulty weight bearing on that side. And once they got imaging done, it was determined that he had suffered a rather complex ankle injury that involved a fracture of his fibula, which is the small non-weight-bearing bone on the outside part of the ankle, but that it had also involved ligaments in the ankle, specifically something we've called the syndesmosis in the past, and that's the thick connective tissue that holds the fibula bone to the tibia bone and stabilizes the ankle joint. So usually this happens when the fracture occurs at a certain level above the ankle joint, and there's usually a rotation injury. So the bone breaks, and then the injury is progressively extends up into that tissue above the level of the break. So Rashad had to undergo or is undergoing surgery for this, which will involve putting a plate onto the fibula to stabilize and align the fracture, and then usually reinforcing the ligament that was torn by placing some type of a device. Sometimes it's a screw, sometimes it is a thick suture material attached to two little metal washers that help to hold those two bones together while that tissue heals. So evidently and obviously, this is a big injury. This is not a simple ankle fracture. And as a result, it is with high likelihood that he is done for the season. Obviously, that means he is in a sit situation if you have him on your team. And quite honestly, if you don't have room on your bench or you don't have an injured reserve slot, I would basically drop him and start looking, perhaps pick up Walker if he's still available, who is his primary backup. All right, now we'll pivot a little bit. We will still talk a little bit about ankle injuries, and we will talk about Baker Mayfield. So Baker is the quarterback for the Carolina Panthers, won the job in camp with Sam Darnold, who actually had an injury as well and is still in rehab currently. Baker had an injury where he was caught low, and he also had a twisting injury that involved the ankle. In his situation, he suffered an ankle sprain. And as we've discussed in the past, there are different types of ankle sprains. The most simple ones involve the ligaments that hold the bones of the foot to the bones of the lower leg. In his situation, he also injured that syndesmosis, so that thick tissue that is between the tibia and the fibula. When you get an injury up into that level, the way you treat it can vary significantly depending upon what you do, and specifically in an NFL player, what position he plays. Now, a few weeks ago, we spoke about Mac Jones, who also had an injury like this. And at the time, he had gotten a second opinion recommending possible surgery. In the case of Mac Jones, he personally decided to not have the surgery and is working on rehabbing it. And as we see, he's still 3 going on 4 weeks out and still not approaching a time when he's going to play. So now Baker has that same injury, and he is going to be in a situation, again, of some prolonged rehab. He did get a second opinion in his situation, and that second opinion did not recommend considering any type of surgery. So we think the severity of his syndesmosis injury, his high ankle sprain, is less than Mac Jones. But I would anticipate at least 4 weeks. He will probably go on injured reserve. And generally, he was not a level 1 or a tier 1 quarterback. So picking up his backup or another starter from a lesser team is probably the best option for you. So he is a sit. Now, the next person I'd like to talk about today may cause a little bit of consternation for the Seattle area fans, as we're going to talk briefly about Russell Wilson. So he has obviously not been performing as well as we have been used to seeing him do as a Seahawk for a number of years, and some people are happy about that. But what we're finding out is that he has been nursing an injury to what is called his lat or his latissimus muscle. Now, to try to explain that, essentially that is a very large muscle on the back of the shoulder, which essentially connects the upper part of your arm, the humerus bone, to your back. And that involves essentially the ribs and the spine. And so it's a very, very big muscle. It's a very important muscle. If you do something like, say, swim competitively like Michael Phelps, it is probably one of the most developed muscles in those athletes because it generates a lot of power pulling the arm from above shoulder level down below. But again, in a quarterback, that's going to be a big muscle that helps to stabilize and help him to throw. So he has had some type of an injury in that area, which is not a very common injury that we talk about. Now, what's interesting in his situation is he elected to undergo what's called a PRP injection, which is a platelet-rich plasma injection. This is a situation where they draw blood, they spin it down in a centrifuge, and they take out a certain percentage of that has growth factors in it, which when injected in certain situations, such as muscle injuries, has been shown to stimulate or accelerate the healing process. So he will be playing this week. He will probably continue to struggle in the same way he has because an injection like this does not cause things to go away quickly, but he will be somebody who will play this week. And the last one I wanted to touch on today is similar to a few other injuries we've seen, and that's Keenan Allen. Now, Keenan's been out a little bit, but it's about time we touched on him and talked a little bit about his situation. He's obviously a wide receiver for the Chargers. He's been a very strong producer in fantasy leagues, and he was actually injured in week 1 of the season and still has not come back. Now, his situation is he had a hamstring injury. So the hamstrings are the big, thick muscle mass in the back of the thigh. And just last week, we spoke about Jahan Dotson of the Washington Commanders, who had a hamstring injury as well. Now, Dotson is younger, Keenan is older, and I think we're seeing some of the differences that happen as we get a little bit older. As Shannon is fond of saying, these soft tissue injuries take a significant amount of time sometimes to heal, to knit, to get strong again, and to regain flexibility. And all of these things decline as you get a little bit older. So in Keenan Allen's situation, he is actually going to be practicing on an individual basis this week. And so it looks promising that he will get some time in the game. So I think people who have been keeping him on the bench for their team who need somebody as we start our bye weeks should consider playing him. But if you do not have to, I would sit him this week and wait one more week until you play him. So I want to thank everybody for taking the time to listen to our podcast heading into week 6 of the NFL season. And we will look forward to discussing other injuries as they come up and try to keep everybody informed about how to make smart decisions about their fantasy team.